Hi, this is Michael Jordan, President of our Labor and Strategic Accounts Division at MagnaCare, joining you today from our New Jersey office. Today's segment is on union population benefits and what impact has healthcare reform had on them. So as a backdrop, a couple things that are important to note. Over the past decade, we've seen a decrease in union population. In fact, in the last century, we've seen a significant drop-off from where we were in the past. Employers, especially those under 50, as a result of healthcare reform, have now started looking at options that historically they never looked at before. Some of those would be exchanges, both individual and small employer-based exchanges, where in the past, as part of a multi-employer program, you didn't have options like that. And that's now driving a lot of those employers and individuals to look at other options, which is clearly having an impact on collective bargaining arrangements. No surprise, total cost of care has gone up significantly. Unless you haven't been in the healthcare world in a while, we know we've been experiencing high single-digit to low double-digit trend increases year over year. When you compound that over the last 5 or 10 years, you've seen significant jumps in cost. The bigger challenge for labor unions is that with that bigger jump in cost, there have been sacrifices or trade-offs for wages and other things that are important as part of the collective bargaining process. Let's also not forget, in 2014, the elimination of annual and lifetime maximums had a significant impact on a lot of labor unions that we've worked with and abroad. And really what that did is it drove up costs because many of those benefit plans were managed in a way where they managed it to an annual cap of $100,000 or $250,000. Those plan sponsors have now added stop loss. They've increased costs above that point up to their stop loss point. And in addition, we've obviously dealt with a lot of trend. So that's had a significant impact on those plan sponsors. The largest looming impact of the Healthcare Reform Act that sits in front of us right now is the Cadillac Tax. And although delayed to 2020, this 40% excise tax will have a significant impact on those multi-employer plans that have rich benefits. And let's remember, a lot of the multi-employer benefit plans have rich benefits because they've made sacrifices and trade-offs in other areas to maintain those levels of benefits. So where does that lead us? That leads us back to the discussion we've been having over the past year and beyond, and that is a focus on the total cost of care is critical. You need to put in population health management programs. You need to put in high performance networks. You have to look at where care is being rendered. So a careful review of your SPD and what you're doing on the medical management side is going to play such an important role as a labor fund wants to stay below that Cadillac tax. Lastly, lobby, lobby, lobby. Go after your politicians, work with them. We have a presidential election coming up. Let's make sure that we take this Cadillac tax and put it off for good. Thanks.